Hello, this is our lecture number 45, and this is all on some other forms of addiction to abuse substances, alcohol and steroid abuse in particular. And we're going to take a look at both of these. In some ways, they follow along some of the things that we talked about with respect to other classic drugs of abuse, but in other ways they're different. So we'll get into some of those complexities, some of those details as we go along. Um, the whole area of alcohol abuse is one that has been marked, I think, in the past by some of the things that we talked about in the previous lecture. That is to say, there's been this idea, I think, for too long that alcohol abuse is really all about an individual's personality, that it's about weaknesses in terms of their character, and biological factors have been dismissed. But we know now that that's not the case, and increasingly scientists are finding, important, biological predispositions and important changes that occur in the brain as a consequence of alcohol abuse. And indeed, those changes, in fact, may be responsible for the continuing alcoholism in some individuals. So again, with that as a pretext, let's begin to explore this a little bit and take a look at the severity of the problem. When you take a look at alcohol abuse, and again, we're talking about the data in Americans, but this is something that extends to many other cultures. By far, alcohol use far exceeds the problems that occur with the use of tobacco or with marijuana or cocaine and crack or heroin. Um, Alcohol use and abuse is almost epidemic in many different cultures. And if you take a look at abused substances in general, it far exceeds what we see with other drugs of abuse. So keep that statistic in mind. I think that it's a very important one. Um, when you take a look at some of the facts here, one of the things that we need to recognize is that the amount of alcohol that an individual drinks is going to have an impact in terms of severity, of symptoms. For example, moderate amounts of alcohol are associated with relaxation, and indeed, there's probably nothing wrong for most individuals to have a drink. But it's when you have greater amounts, that's when you get impairment in terms of judgment. That's where you get biological impairment in terms of actual damage that occurs to the liver and to the brain. Certainly, the extreme alcoholism called Korsakoff syndrome, something that I think that we've already talked about a little bit in some of our other lectures, but very much, the amount of alcohol that one chooses to consume is going to have an impact, from a very mild impact to a very severe impact. The Diagnostic and Statistical Manual, the DSM-5, says that alcoholism dependence is the continued use of alcohol in spite of the fact that there's social harm being done, that there's a medical, physical harm being done. Individuals recognize that, but they can't seem to stop. They can't seem to quit. Even if they make the decision to show reductions in their drinking, this is not something that lasts for a very long period of time. So again, that's basically what the DSM says, and this compares very favorably to other forms of addiction. The effects of alcohol on our biological systems does so, it impacts biological systems in many different ways. For example, we've talked in some previous lectures about the action potential and the importance of sodium in action potentials. Well, one of the things that alcohol does is to inhibit sodium across the membrane. Another thing that it does is to actually expand the surface membranes. It also decreases a very important neurotransmitter in the brain, serotonin. It elevates response by GABA receptors, produces more GABA receptors in the brain. It blocks glutamate receptors. It increases dopamine activity. This last one, notice that, just as I noted to you earlier, just about every form of addiction known to man involves dopamine. Okay, and again, there's going to be an exception to this when we get to the area of steroid abuse. So when we take a look at alcoholism, typically what we can do is we can divide it up into two categories. One that's called type 1 or type A, where we have typically late onset. It's very gradual. There doesn't seem to be a very strong genetic component at all. There's fewer genetic relatives with alcoholism. There's no real significant gender difference here, and it tends to be a less severe form of alcoholism. When you take a look at type 2, or what is also called type B, the characteristics are more severe. Onset occurs at a relatively early time in life, that is earlier than 25 years of age. The onset appears to be quite rapid. There are individuals tend to have more genetic relatives with alcoholism. Men outnumber women here by a very significant manner, by about 2 to 1, 3 to 1. It's often severe, and it's associated with criminality. So when you compare the two, type 1 or type A is certainly more mild. If you take a look at these symptoms, type 2, seems to be much more severe. And again, the onset occurs at a much earlier period in life. Now, some of the research that's been done in this area, which is, very strongly implicates genes, is when we take a look at sons of alcoholic fathers. For example, if you have a situation where you're the son of an alcoholic father, then you roughly have a 5-fold increased risk of developing alcoholism yourself, as opposed to having few or no relatives, or your father is not alcoholic. So again, this is a dramatic difference, and when we compare sons of alcoholic fathers with other young men of the same age and same current drinking habits, the risk factor here is quite substantial. An interesting treatment for alcoholism is this drug that has been developed, which is called Antabuse. Now, to understand the impact of Antabuse, you have to understand how alcohol is actually metabolized once it enters, a biological system. It's converted to acetaldehyde, which actually is a poisonous substance, and then to acetaldehyde dehydrogenase, and then ultimately to acetic acid. This is, the normal chain of events that occurs in the conversion of alcohol ultimately into acetic acid, which, by the way, has some benefits. It can reduce inflammations, it can lower blood pressure, it can actually be an antibacterial. You know, the metabolism of alcohol to ultimately to acetic acid is not a bad thing. Antabuse, what it does is it antagonizes the effects of acetaldehyde. Acetaldehyde dehydrogenase. And when that occurs, what happens is acetaldehyde builds up, it becomes poisonous, and individuals become sick, nauseous as a consequence of it. So what happens then is that alcohol then becomes associated then with all of these, you know, the taste of alcohol becomes associated with all of these illness, physical changes. Antabuse is moderately effective in suppressing the future drinking of alcohol. And by that I mean that it does seem to help some individuals to stop drinking, but certainly not all. What I want to do is I want to transition now into, you know, another type of drug abuse, and it has to do with these synthetic hormones that are called anabolic steroids, and the impact that they have in terms of helping an individual in terms of athletic preparedness and in terms of building muscle, to elevating endurance and improving speed. It is something that is used now in just about all different sports in order to get bigger, stronger, and faster. And certainly many of you are probably aware of this individual, Lance Armstrong, who really is the poster child for cheating in that he took anabolic steroids and other banned substances for many years, even though he denied it, and won many Tour de France races. In fact, he was a cheat and an imposter, really, as far as his athletic accomplishments, because they were all drug aided. This in and of itself is a very interesting story, but there are certainly many other athletes that have also abused these substances and continue to abuse them. We need to know a little bit about how these synthetic hormones act. You know, anabolic steroids are the synthetic variation of natural steroids, like testosterone, for example. Steroid hormones have very pervasive effects once they get into circulation. They get up into the brain. Again, just follow this timeline that you see here. They ultimately are taken up by very specific receptor sites in the nucleus of the cell, where they in turn modify the formation of new proteins, again, messenger RNA. These hormones, synthetic hormones, act in a variety of different brain areas and peripheral tissue. I've often said that they act on just about every single organ in the body, but again, they're principally used, you know, by athletes in order to get bigger, stronger, and faster, and essentially cheat at their sport. This shows some of the potential side effects of anabolic steroids. Let's take a look at this as they impact men and as they impact men and women. So what you see in both men and women are strokes and blood clots, nausea, high blood pressure and heart disease, liver damage, bloating, aching joints, aggressive behavior, very significant mood swings, increased risk of tendon injuries, urinary and bowel problems, severe acne. That's another characteristic. This is what you see in both men and women. What you see in men, in addition to this, headaches, baldness, impotence, reduced sperm count, shrinkage of the testicles, enlarged prostate, and development of breasts in males, which is something that's referred to as gynecomastia. When you take a look at the impact upon women, you see a number of changes: reduced breast size, enlarged clitoris, increase in facial and body hair, deepening of the voice, very significantly menstrual problems, where it actually can lead to a complete disruption of a woman's menstrual cycle. So again, there are many, many side effects of anabolic steroids that we're learning more and more about, and this certainly is a hazard for individuals who make this very unwise choice to cheat at their sport. Again, it's important to learn a little bit more, about these. Here's what the numbers look like. Here in the United States, the Mayo Clinic estimates that nearly 1 million middle and high school age kids experiment with anabolic steroids every single year, and they're putting themselves at risk. In addition to getting bigger, stronger, and faster, they're also putting themselves at risk in terms of all these health problems that I noted to you in that previous slide. Are steroid hormones addictive? That's an incredibly important question, and I'm going to try to answer that for you. But let me say at the outset that they are addictive, but in a very different way. They are addictive for some individuals, but it's principally through what we call secondary reinforcing effects. In other words, individuals who take anabolic steroids to get bigger, stronger, and faster, they like the way that they look. The primary reinforcing effects of anabolic steroids is nowhere near what you see in the case of classic drugs of abuse, like cocaine, heroin, for example. So those primary reinforcing effects, they are evident, but they are not anywhere near as powerful. It does produce this feeling of invincibility, some slight euphoria as well, but it's nowhere near what you see in the case of classic drugs of abuse. Again, the primary driving force for taking these is that individuals like the way they look as a consequence of using them. They like the way they can perform after using them. There are withdrawal symptoms that occur as a consequence of termination of anabolic steroids. You get mood swings. You get restlessness, you get this loss of appetite, insomnia, reduced sex drive, depression, and unfortunately suicidal tendencies. There are some very interesting studies that have been done of individuals who have suddenly gone off using anabolic steroids and have been suicidal, and in some cases have been successful in terms of committing suicide. So again, these are all characteristics of steroid hormones, and again, you see some similarities with other drugs of abuse, but also some other dissimilarities, especially in terms of this secondary reinforcing effect being so powerful and so potent. Importantly, it's also been shown that steroid hormones are a gateway drug. And what we mean by that is individuals, after using them, are more likely to go on to using another drug, one that is considered to be put an individual at even greater risk. So again, there's a springboard effect, a gateway effect in which individuals are more likely to use other abused substances after first using anabolic steroids. So that is also another, high level of concern. What do we know about dependence in humans in terms of these anabolic steroids? Well, One of the things that we're learning now is that many abusers of anabolic steroids are not necessarily competitive athletes. They are individuals, for example, who are really into bodybuilding, very, very much into their appearance, how they look. That's been one of the single biggest growth factors in the area of anabolic steroid abuse. That and the fact that many more women are using them than, let's say, 10, 15, 20 years ago. What we also know is that the reported use of anabolic steroids is about 3%. This is in the case of young men. That's where you see the greatest anabolic steroid use, and it's in the neighborhood of about 3% of young men use anabolic steroids. 30% of users develop dependence. That is roughly a third of those individuals who use anabolic steroids ultimately become dependent upon it. But it's very different form of dependence, and we still don't really know enough about it. Um, how is it different from classic drugs of abuse? Well, first and foremost, you don't get that immediate intoxication that you get on the experience, of this incredible, intense rush that you see in the case of classic drugs of abuse like heroin and cocaine. There's the effects are not immediate. The reward effects are not immediate. They're delayed effects in terms of muscle systems, for example, but again, no immediate intoxication. Some euphoria, a little bit, but not anywhere near what you would see in the case of cocaine or heroin. Opioid systems may be more impacted than dopamine systems. I noted earlier that there's some exceptions to this whole idea that has been put forth for a long time, that addiction is really a dopamine system, exclusively a dopamine system phenomena. Well, in the case of anabolic steroid abuse, it does not appear to be the case that the dopamine system is playing an important role. It appears instead that opioid systems may be much more impacted. So again, some very significant differences here. When we explored the whole area of treatment, I think a lot of the same things can be said about treating individuals that are alcoholic or treating individuals that are anabolic steroid abusers. That really, you're talking about the ability to treat a very complex problem, a problem that's a brain disorder. It's an organic disorder, that it's a situation in which the brain, as I noted to you earlier, has been hijacked by that chemical. And indeed, there's a variety of different treatments that potentially might be successful, ranging from drugs. We noted Antabuse in the case of treating alcoholism, to very conventional types of talk therapies, to family groups, for example. These, treatment methods are very similar to what we see in the case of treating alcoholism as well as anabolic steroid abuse. So that really, captures, I think, the essence of this particular area in terms of addiction. I think that there's a number of good videos there that are in the syllabus that you should be taking a look at. But what we're going to do now is we're going to move on to the area of mood disorders and begin to explore the underlying behavioral changes that we see that may be responsible for mood changes and like depression, and then talk a little bit about its treatment. So we'll do that in our next lecture.